Still on development centered on Africa, the U.S. President Donald Trump says America will find and kill militants fighting African states which are under the backing of the Islamic State. Although finding them could be tough, President Trump in a post on social media says America will find and kill the militants. They are allegedly hiding deep in the mountains of northeastern Somalia. Less than 2 weeks into his term, Mr. Trump has targeted the senior Islamic State attack planner and other militants in Somalia's semi-autonomous region of Puntland and has destroyed the caves they live in, allegedly killing many terrorists without harming civilians. The fact that Somalia was the target of America's first major military operation under the new administration surprised many citizens in the country who were afraid that the U.S. may abandon them. In his first term in office, President Trump withdrew about 7,000 American troops, but Joe Biden reversed his decision. In a twist, President Trump says he's revoking the security clearance of his predecessor, Joe Biden. This means Mr. Biden can no longer receive classified information on U.S. security. In a post on Truth Social, President Trump says Mr. Biden cannot be trusted with sensitive information, citing a Justice Department inquiry into his storage of classified files, which says Joe Biden has a poor memory. He says his administration will therefore be revoking his security clearances and daily intelligence briefings. President Trump did not fail to add that he is doing exactly what Joe Biden did to him when he was president. In 2021, Mr. Biden instructed the U.S. intelligence community to stop Donald Trump from accessing details on national security, which is a courtesy enjoyed by former American presidents. And some heat seems to be coming on the U.S. president from the judiciary. A U.S. federal court has issued a temporary order to stop Mr. Trump's plan to put thousands of staff of the United States Agency for International Development USAID on leave. The judge's restraining order would block 2,200 employees from being put on administrative leave as was scheduled for by midnight Friday. The agency employs about 10,000 people, two-thirds of whom work overseas. Only about 600 out of the 10,000 employees would have kept working at the agency under President Trump's plan. President Trump, who is a long-term critic of overseas spending, singled out the agency, arguing that U.S. aid is not an agency putting taxpayers' money into valuable use. And for a deeper look into the withdrawal of aid to countries in dire need of it, most especially medical aid, a U.S.-trained occupational therapist who is the director of occupational therapy at Dose State Specialist Hospital, Victoria Amu, joins me via Zoom from Benin City. Well, thank you so much for joining us at this time. What do you think of President Trump's policy that is withdrawing aid from he allegedly tried to withdraw funds and, of course, put some staff on administrative leave from the U.S. aid?
Very, very devastating for these donor-dependent countries. Why do I say devastating? Devastating on the healthcare systems. There's going to be disruption. If he's able to finally achieve it, there's going to be disruption of disease control programs. There's going to be reduction in maternal and child health initiatives. There's going to be funding gaps in health infrastructure. There's going to be increase, which means that there'll be disparity now between the elites and the rural. Going to be setbacks in global health goals. The impact of emergency health response will reduce tremendously. Emergency health response is when we had Ebola or we had COVID-19. If there's no U.S. donation into countries that actually are donor dependent in order to get these programs going, there'll be a devastating effect. There will also be on other donors. However, there's going to be decreased assets. That is like the comedians in Nigeria will say, it's the baba of them all, is that the decreased access to HIV prevention, treatment, malaria, and tuberculosis would be at a devastating end. Then there's going to be impact on public health researches. Public health researches is what enables doctors, nurses, health researchers to be able to come up with drugs, improve on the drugs we have for the nation, and improve on those good things that will help health. So when you look at all of this, and there's going to be long-term economic health consequence, because in today Nigeria that we live in, or in today Africa, we understand that HIV/AIDS is ravaging the population. And if there's no US donor, the US donor is cut off for those drugs, that means the antiretroviral effects will be high. That means that there will be no medication to help the antiretroviral issues that will come up with HIV patients. So it's a whole lot.
All right. So we understand that the United States is the single highest donor to the WHO, but President Donald Trump has signed a law withdrawing the United States from being a member of the World Health Organization. But my question will be, why is this a concern for many nations when shouldn't we be looking inwards for our own homegrown solutions to some of these devastating illnesses rather than wait for handovers from world nations?
Because of the timing of the court, it is truly hard for you to see nations who will be able to brace up to the management of these diseases and these issues. For the lifetime that this US AIDS donation has been coming into African countries would by now be self-reliant. And that's what President Trump is talking about. This is the time that these countries are supposed to have matured to become self-reliant. But you don't find that. Most of these countries still do medical tourism because all of the healthcare facilities in all of these donor-dependent countries are shambles. You know, most people still go out to seek health. Then the HIV/AIDS medication. That's the baba of it all. It makes it impossible. These countries cannot afford to buy those medications. So the donation makes it affordable. It makes it reachable. So they should have been self-reliant. It all tells you that when countries have donors, it's either they don't key into the donation by paying their counterpart funding, or they don't have capable hands who manage those programs. Part of this USAID donation is what's filtered into sustainable development goals. Sustainable development goals is supposed to be a trickle down, where this donation will actually reach the people that are intended to feel it. The Sustainable Development Goals has poverty alleviation, it has healthcare, it has education, it has infrastructure, it has agri and food insufficiency. But the question is, how far do these programs actually reach the people they are supposed to reach? It only takes probably a governor who is passionate about giving support to his people, or it takes a coordinator of a program. Look at the HIV programs, the SACA programs. Most of those programs are just there to enrich the coordinators because the coordinators, some of them do not manage those programs very well. And people are out there. Every time you go to the clinic, you find out that they don't have tools, they don't have equipment. They don't have even stuff to be able to take the viral load of HIV patients every week or every month. So what can we do?
All right, Victoria, we're looking at all of this now. It has happened. What can countries do at this time?
Okay, at this time, countries need to start bracing up. You know, look at your healthcare. Look at your healthcare systems. Look at the gaps that are presently lacking in your healthcare system. Look at your educational system, because those are places where donation actually come in from United States aid. You know, look at your education system. Look at where there are gaps. Is it training? Is it teacher training? Look at your health. Is it building capacity on health workers that you have training, or is it infrastructure? Then you go look at agric. What do you lack? Do your farmers lack equipment? Is there food sufficiency throughout the whole year, or there's food insecurity? You know, so then you go again, you look at your roads. You know, do you have good roads? Do farmers have adequate roads to bring their goods from the farm to the market? A few years ago, Lagos State in Nigeria was trying to do that with cows and beef. You know, the state government actually procured vehicles and actually went into the farms to get the cows and bring them out, you know, for the farmers. So is the government of the day going to be able to brace up to those things? For you to have a brace up to those things, it takes the government of the day being very passionate about poverty alleviation. It means them being passionate about healthcare.
All right, Victoria Amuwo, Director of Occupational Therapy at Those State Specialist Hospital. Thank you so much for talking to us.
You're welcome. Thank you for having me.
At this time, we'll take a quick break, and when we return, we'll have more stories for you. Stay tuned.